Fatty liver disease is a serious threat that is rapidly spreading around the world. It used to be considered a rare disease, but today it affects even children. More than 30% of adults over the age of 35 suffer from this disease, which can lead to cirrhosis of the liver and even liver cancer. It is important to understand that fatty liver disease is one of the leading causes of liver transplantation worldwide. Fortunately, the liver has an amazing ability to regenerate, but only up to a certain point. Early diagnosis and timely treatment can stop the progression of the disease and even reverse fatty liver disease. In addition to understanding the symptoms, it is important to know the main causes of fatty liver related to nutrition. If you suspect that you have this disease, you need to completely abandon certain foods. We will look at the symptoms of fatty liver dystrophy that cannot be ignored. We will pay special attention to 6 early symptoms and more serious complications that require urgent medical attention. It is important to know that fatty liver disease is often asymptomatic, so many people discover it accidentally during ultrasound or blood tests performed for another reason. Fatty liver disease is a serious disease that can develop unnoticeably, but its consequences can be very serious. Although diseases such as diabetes, high cholesterol or high blood pressure are more well known, fatty liver disease also deserves attention. It is important to understand that even if you are diagnosed with fatty liver disease at an early stage, it can be completely cured due to the incredible ability of the liver to regenerate. You may not feel any symptoms, so it is important to be aware of the initial signs that may signal liver problems. Here are 6 key symptoms that may indicate fatty liver disease. 1. Abdominal pain and heartburn. Studies have shown that people with fatty liver disease often experience dyspeptic symptoms such as heartburn, a burning sensation spreading from the chest to the throat, belching, and a constant feeling of full stomach. These symptoms are significantly more common in people with obese liver, by 25% compared to other people. 2. Excessive gas formation. Those who suffer from fatty liver disease often face excessive accumulation of gases. Radiologists have noted that the presence of fat in the liver can contribute to this problem, sometimes even making it difficult to visualize the pancreas during examination. 3. Pain in the right side of the abdomen near the ribs. This discomfort is often felt in the upper right quadrant, where the liver is located, and manifests itself as a nagging pain under the rib. An enlarged liver can compress a nerve, causing pain in the right shoulder area. 4. Loss of appetite. Decreased appetite in people with fatty liver disease can be caused by metabolic changes, liver inflammation, and hormonal imbalance. Symptoms such as nausea, abdominal discomfort, as well as psychological effects, contribute to a decrease in the desire to eat. 5. Overwork. The liver plays a crucial role in nutrient metabolism and energy production. The presence of fat in the liver can significantly disrupt these functions. Inflammation of the liver, which accompanies the accumulation of fat, can lead to fatigue and general weakness. 6. Yellowing of the skin and whites of the eyes, jaundice. This symptom is less common, but may indicate more serious liver problems. If you notice one or more of these symptoms, it is important to consult a doctor for diagnosis and consultation. Early diagnosis and treatment will help prevent serious consequences for your health. Liver dysfunction also affects the production of hormones that affect mood, sleep, and overall energy levels, leading to constant fatigue. The 6th initial symptom is nausea. Nausea with fatty liver dystrophy or liver steatosis occurs for various reasons related to impaired liver function. The reduced ability of the liver to filter out toxins leads to the accumulation of harmful substances in the blood that cause nausea. In addition, excess fat in the liver can lead to inflammation, causing abdominal discomfort or pain accompanied by nausea, which also affects digestion, especially the production of vitamin B, which is necessary for the digestion of fats. Finally, an enlarged liver puts pressure on the stomach and other organs, creating a feeling of fullness and nausea. These symptoms reflect inadequate liver function and usually indicate initial hepatic steatosis. With liver steatosis, urine darkens because the affected liver secretes more bilirubin, which enters the bloodstream. This bilirubin is filtered by the kidneys and excreted in the urine, increasing its concentration and giving it a darker color similar to tea, and this is the first late syndrome. The second late symptom is white nails, also known as lanias, which can be a sign of liver problems such as cirrhosis or hepatitis. This nail discoloration is due to changes in blood composition and circulation, often associated with liver disease. The inability of the liver to efficiently process and eliminate toxins affects various systems, including blood circulation. The third late symptom is red spots all over the body. When the liver fails to produce the proteins needed for blood clotting, this can lead to a decrease in the number of platelets, known as platelets, and problems with the absorption of fat-soluble vitamins, including vitamin K. This deficiency is vital for blood clotting, and as a result, red spots may appear on the skin, signaling liver problems. The fourth late symptom is vascular asterisks. Hormonal imbalance caused by liver problems can manifest themselves in various, sometimes imperceptible symptoms. One of the early signs is the appearance of vascular asterisks caused by dilation of blood vessels due to excess estrogen, which the liver does not process properly. Skin changes may also occur, for example, severe itching, most often on the palms, but spreading throughout the body, causing discomfort. Another symptom is jaundice, which occurs due to the accumulation of bilirubin in the body, a yellow pigment formed during the breakdown of red blood cells. Normally, bilirubin is processed by the liver, but when its function is impaired, it accumulates, staining the skin and eyes yellow. One of the late symptoms of liver problems is arteriovenous malformation, dilation of blood vessels in the palms. This characteristic redness may be a sign of hormonal changes or liver problems, such as liver steatosis. Pale stools can also be a sign of liver problems, as it does not properly process the salts that are necessary to give the stool color. As a result, the stool becomes paler, signaling a violation of normal liver function. Another late symptom is chicken blindness, a visual impairment in low light conditions that can be caused by vitamin A deficiency. The liver plays an important role in the storage and metabolism of vitamin A, and in its diseases this ability is impaired, leading to deficiency. Gynecomastia, an increase in breast tissue in men, may be an indirect consequence of liver disease. The accumulation of fat in the liver disrupts the hormonal balance between estrogen and testosterone, which leads to the appearance of female signs. Finally, pain in the right side of the abdomen near the chest can also be a sign of liver problems. It is important to remember that these symptoms can be caused by other factors. Therefore, if you experience any of these symptoms, you should consult a doctor for diagnosis and prescribe the necessary treatment. The increased size of the liver can compress the nerve, causing pain in the right shoulder area. This pain also reflects an enlarged liver condition and related problems, so it is very important to recognize the symptoms and take appropriate action. Even if you do not have any symptoms, but there are risk factors for developing liver steatosis, it is important to know how to determine the presence of this disease. Early detection of liver steatosis allows you to completely eliminate it, protecting the liver from damage, even in the presence of scars and fibrosis. This helps prevent progression to more serious diseases such as edema and liver cancer. Imaging tests such as ultrasound, computed tomography or magnetic resonance imaging can help diagnose liver steatosis. Although it is normal for the liver to contain a small amount of fat, less than 5% of its weight, exceeding this threshold leads to noticeable changes in the images indicating excessive accumulation of fat in the liver. There are 3 degrees of liver steatosis. The first degree is mild steatosis, the second degree is moderate steatosis, and the third degree is characterized by a large accumulation of fat in the liver. Who is more likely to develop fatty liver dystrophy and what is the risk? The first risk factor is obesity. Obesity significantly increases the risk of developing liver steatosis, in which excess fat accumulates in the liver. This excess fat impairs liver function and causes inflammation. Over time, this inflammation may increase, which will lead to scarring on the organ. This scarring is worrisome because it can progress to more serious conditions, including hepatic cateterism, which seriously undermines liver health. The second risk factor is type 2 diabetes mellitus. People with type 2 diabetes face a higher risk of developing liver steatosis. The condition is associated with insulin resistance, which is a central aspect of this disease. This resistance leads to an abnormal accumulation of fat in the liver, which negatively affects its functions. This situation can progress to liver inflammation, increasing the likelihood of more serious liver damage. People with high blood pressure have a high risk of developing liver steatosis, as hypertension can contribute to the accumulation of fat in the liver. Excessive alcohol consumption significantly increases the risk of developing liver steatosis. Alcohol is metabolized in the liver, causing oxidative stress and inflammation, which leads to the accumulation of fat and liver cells, disrupting their functions. A sedentary lifestyle also increases the risk of developing liver steatosis, since lack of physical activity contributes to the accumulation of fat in the body and liver. Physical inactivity is also associated with other risk factors such as obesity and insulin resistance, which increases the likelihood of liver failure. Other causes of damage include taking medications such as amiodarone, tamoxifen, and corticosteroids. Nowadays, liver obesity has become a common problem in children, partly due to lifestyle. Previously, children spent time in a more active form, despite poor nutrition, engaging in activities such as cycling, roller skating and ice skating. Today, the preference for electronic games has replaced real physical activity. To combat this, it is recommended to take walks or engage in other moderate activities for at least 150 minutes per week. This can bring significant benefits to the health of your liver, including reducing inflammation, reducing fibrosis, and reducing liver fat, which improves your overall health. Third, avoid drinking alcohol. Reducing or quitting alcohol consumption is necessary to protect the liver. Alcohol damages liver cells known as hepatocytes, and it can lead to the accumulation of fat in the liver, which worsens its function and the general condition of the body. Liver health is closely related to nutrition, and often improper nutrition leads to problems with this organ. Fortunately, a balanced diet can be the key to eliminating this disease. Let's take a look at the 5 most toxic liver foods that should be avoided if you have an oily liver. 1. Highly processed foods. Packaged foods and fast food are harmful to health, as they contain large amounts of sugars, saturated fats and additives that increase the risk of liver steatosis. Avoiding highly processed foods is crucial to prevent liver obesity. 2. Refined wheat products, such as bread, pasta and crackers, increase the amount of fat in the liver. Avoiding refined wheat helps prevent liver obesity because it can quickly raise blood sugar levels, contributing to insulin resistance and fat accumulation in the liver. 3. Products containing fructose. It is important to clarify that fresh fruits are not included in the menu. The biggest harm that causes liver obesity is corn syrup and fructose, which are found in carbonated drinks, cereal bars, packaged juices, tomato sauce, ketchup, mustard and jelly. 4. Salt. Why does salt damage liver cells? Salt in large quantities disrupts the process of digestion and assimilation of fats, thereby increasing the load on the liver. In addition, this increases bacterial growth in the intestine, disrupts the enterohepatic circulation of bile acids. All this can cause bile thickening, give prerequisites for the formation of gallstones. 5. Vegetable oils. The modern diet is rich in omega-6, which causes inflammation, and poor in omega-3, which reduces inflammation. It is advisable to avoid the use of vegetable oils, as many of them are rich in omega-6 fats, an excess of which can provoke inflammation and contribute to the accumulation of fat in the liver. 6. Sugar. To maintain liver health, it is necessary to reduce sugar intake, including fructose. Sugar significantly contributes to the accumulation of fat in the liver, increasing the risk of liver steatosis, a condition that negatively affects liver function. Now let's look at the 6 foods you should eat to support liver health. 1. Turmeric. Known for its anti-inflammatory properties, it should be consumed with a pinch of black pepper to improve its absorption and effectiveness in the body. 2. Coffee. Containing caffeine, tocopherol, vitamin E, and chlorogenic acid. Coffee is a controversial product. In a study published in 2013, it was proved that daily coffee consumption reduces the risk of developing chronic liver diseases and their exacerbations. First of all, we are talking about fatty liver disease and oncopathologies. In another study, scientists identified the mechanism of this positive effect on the liver. The main mechanism is the effect on liver enzymes and the prevention of fat accumulation in its tissues. Another mechanism is the effect of antioxidants on the liver, strengthening its protective properties and resisting oncopathologies. But it is important to note that we are talking about regular but moderate coffee consumption. 3. Olive oil. Consuming 3 to 4 tablespoons of olive oil per day can significantly reduce the accumulation of fat in the liver, contributing to improved liver function. 4. Avocado. Effectively reduces the fatty layer in the liver. Avocados are distinguished by a high content of glutathione, a powerful antioxidant that fights fatty deposits in the liver and helps strengthen it. 5. Cruciferous vegetables, such as broccoli, Brussels sprouts and cauliflower contain sulforaphane, which helps reduce liver inflammation and cancer risk due to the sulfur it contains. 6. Green tea. One study suggested that green tea reduces the risk of liver cancer. However, the study was conducted in a small group of participants. Therefore, for unambiguous assurances and statements, additional research is needed. 7. Meat. Low-fat varieties. We prefer beef, rabbit and poultry to lamb and pork. If there are no liver diseases, a healthy menu should include offal, in particular, beef and chicken. 8. Berries. In the menu that restores liver function, it is worth finding a place for sweet berries. It is sweet, but sour ones won't cheer her up. And even on the contrary, they will harm you. Strawberries, raspberries and strawberries are considered the most useful for the liver. The trace elements contained in them perfectly drive bile and help the liver to cleanse itself. And it is easier for a clean filter to recover. In order for the berries to start working, they need to be included in the menu for 3-4 weeks. But if you have an aggravated stomach ulcer or gastritis, neither raspberries, strawberries, nor strawberries can be abused. Blueberries are also good for the liver. It boosts the immune cellular response and generously shares its antioxidant enzymes. Follow these recommendations if you have an oily liver, and remember, a healthy diet is an investment in your health.